COVID-19 hospitalizations continue to increase, and that is putting a strain on hospitals in the Mobile area, and especially those in rural communities. Investigative reporter Brendan Kirby has been looking into this, and he's joining us now with all the details. So, Brendan, hospitals everywhere, they say they're at near breaking point.
That's right, Lanice, and rural hospitals are feeling the same impact, only they don't have as many resources. The numbers are bad and getting worse. A spokesman for the Escambia County Healthcare Authority tells me hospitals in Atmore and Bruton have managed to find additional space for the COVID-19 surge. But he adds that they haven't been able to transfer patients to other hospitals as they normally would amid tight capacity because area hospitals are overfilled. Dr. Randy Murphy, the Mobile County Health Department's top epidemiologist, sounded the alarm this week about shortages in intensive care units.
We are at a critical shortage of adult ICU beds, and so that is something that we are concerned about. We hear that lots of rural hospitals are calling our hospitals trying to get transfers in, and they're unable to take them.
It's not just a local problem. Hospitals all over the state, and indeed the nation, are in the same boat.
That's not unique to Mobile. We've actually had to transfer patients as far as Louisville, Kentucky, to try to find a bed. We've been some of the hospitals in Tennessee that we normally have seen patients routed to are no longer able to take transfers. That's true in hospitals in Georgia. It's true in Florida. It's true in Mississippi.
That was Dr. Don Williamson, president of the Alabama Hospital Association. He says the reverse is also true. Alabama hospitals are so full that they've been unable to take patients from out of state. Hospital statistics change daily, but Williamson says that as of Tuesday, there were just 68 open ICU beds statewide out of a total of almost 1,700. And even that's misleading, he says.
If you say you have an empty ICU bed, that probably simply means you are holding people in your ER waiting for a bed to become available, and you're going to immediately refill that bed from your own waiting list in the ER.
Dr. Williamson says hospitals would be in even worse shape if not for the new treatments that have shortened hospital stays for COVID-19 patients. But now there are shortages of those treatments. Dr. Williamson says the state has gotten only 40% of the monoclonal antibody treatments it's ordered. Dr. Murphy notes that infections remain high, including 15 current outbreaks at long-term care facilities.
So again, just things are at a very delicate situation right now with regard to the burden of COVID on our hospitals and our healthcare system.
Dr. Williamson says that the good news, if there is any, is that those hospitalizations finally have started to level off, but it's still about twice what it was during the surge last summer. Reporting live, Brendan Kirby, Fox 10 News.